Hi, thanks for joining me again at the end of the day for my podcast. I'm Dr. Cameo Carter. I'm a board certified pediatrician and mom of 3. And today's topic that's on my mind, it's a sensitive subject, but I think it's a really important one to cover in pediatrics. And that is for the bonus add-on questions about siblings that we often get in appointments. So many of us have been in situations where we have an appointment for one of our kids, and we have, just kind of on a side note, while you're there, can I ask you about my other child? And this is a difficult one for pediatricians to address, because we definitely want to be there for you. We definitely want to answer questions for you. But there are time constraints. And it's not just the time, that's part of it, but it's also a value kind of impingement, meaning that this is something that we're wanting to throw in essentially for free. And not be paid for that advice, for that expertise, for experience. So a common situation might be that a parent brings in one child, for an ear infection, and then asks, well, while we're here, can you just check really quick and just see if how brother's cough is doing? Or someone's brought in for a well visit and saying, well, the sibling is also experiencing these things. Can we just ask about that really quick? So this is really tricky because, of course, we know that parents are really busy. It is, hard to take time out to come into a visit. And it's really tempting to try to get everything taken care of in one trip. But from our perspective, from a pediatrician's perspective, it's important to understand that there's various things that are going into what we're doing. One of which is the time. Each appointment is scheduled for one child. Time is set aside to take history, to ask pertinent questions, to do an exam, to give thoughtful guidance, ideally to get documentation done inside the chart during that time. So when a sibling is added unexpectedly, that process doesn't change. We still need to do those same things. It still takes time, attention, it still takes our medical judgment. And if we're not documenting, it's going to be harder for us to remember, what advice we gave or what historically occurred. And that's really important. And again, it's added knowledge and value that we're sharing that is based on our expertise, our training. So essentially, what we're being asked for is to give these things away for free. There can be certain things that are concerning in just terms of a quality of care with this. A rushed side evaluation may miss important details. It can be difficult in a fairness kind of a thing for other parents who have made appointments and have visits upcoming, and it's going to be harder for us to run on time. It's going to be harder for us to have any time in that appointment to do additional documentation, so that's going to be extra time that we have to do that later outside of work. And it can kind of snowball in terms of all of the extra time that it takes and how it affects other patients and in our schedule. And also to, put an additional point in it, every professional, really deserves to be valued and compensated for the work that they do. just like any other service that is provided. If you look at like, going to a lawyer, for an example, you are hiring them for a particular service. And it's not necessarily, unless you have them on this giant retainer, to handle all the legal questions and concerns. Or, like if you're going to an accountant, for an example, you have kind of a scope of what it is that they're going to cover for you. And if it's outside that scope, then that's going to be, an additional service fee. So I think you can kind of look at every professional and understand that you're going to be paying for that additional service, and there's certain scope that's given within that. So I think it's a really difficult thing to navigate, and I have a really hard time doing navigating it in a way that I feel always is appropriate, because I certainly went into this job because I want to help, and I want to be of help if ever I can. I think if a pediatrician is seeing a child and they know that they have extra time and they just want to double check a sibling. So if one child comes in who's sick, and then they're hearing this other kid coughing, and they say, well, let me just do a quick check of the lungs. I think understanding that that doctor knows what kind of time, what kind of resources, what kind of mental load they have, and if they're able to give that essentially for free, that's something that they're offering. I think it's always good for parents to consider what questions they have, and if multiple kids are sick, try to make an appointment for each of them. Even if it's right after, or saying, I've had parents before say they have similar symptoms. Is this something that we could even double book for if there's not a slot right adjacent? And that can be a way that we can both bill and document for the work that we're doing. I think an exception to this is concierge care or direct patient care models, where you're paying essentially a retainer either yearly or monthly. And in those cases, you can ask questions and do a lot of the aside kind of things for different siblings, but that's covered. You're demonstrating value by paying for that, and that's one of the services that already in the stipulation or agreement has been said that this will be part of the things that you get for the monthly or yearly charge that you have. So I think some things that we can do about it. I mean, definitely, I think pediatricians need to do a better job, and that includes myself, of setting some boundaries. In the moment, it is harder to do that. And again, we always want to behave with compassion and care. And so it's really hard for us to say, let's talk about the value that you're putting to it, or say like, I'm going to have you make an extra appointment to talk about that. But I think we really need to have those conversations, and to make sure that we're valuing our time and expertise as well. And if parents try to think ahead, if both kids are sick, can we schedule them both? If there is an adjacent slot, is there another time that you could move both of them to? And we do have lots of parents who ask that too, and that is really helpful. Also, I've had parents do this too, who say, it's at the last minute, asking the front desk if there's a way to add a sibling rather than asking the doctor, I think is really helpful and kind. And then the desk can say like, okay, we'll see if there's any way we can fit you in. If Dr. Carter's running on time, maybe we can squeeze that in. And I think I completely understand from a parent perspective, asking about these things and having questions is you're advocating for your kid. You want the best for them. It shows that you care. Being open to scheduling an appointment for each kid that you have questions about also shows that you value your doctor's time and expertise. Pediatricians want to be thorough. We love our patients and our families. And I think if we continue to set boundaries, I think that's going to also help demonstrate our value and that we're not giving away things for free, but also by spreading awareness and trying to make sure parents know that unless there's like a monthly service fee that covers this kind of thing, schedule an appointment for each of your kids that you have questions for. And that's showing that you value our time, and it's allowing us to be as thorough as we can, doing all the documentation that we need to, and making sure that we serve your child and your family the best that we can.